So the news is kind of mixed. Dr. Omer Awan is with us now to do a little pulse check on COVID and what's to come. He's a physician and a healthcare contributor to Forbes. Dr. Awan, let's work through some of the COVID headlines because we're not so steeped in them these days. A lot of us are kind of going on, with our lives and just figuring, if there's a problem, someone will tell us. So can we do a little bit of a true false here maybe? First, we're hearing that it matters which arm you get your booster in. True or false?
I would say false, Chance. I think it's more important for you to get the booster, no matter what arm it's in. We know that boosters, vaccinations decrease hospitalizations, death, and serious illness, right? There have been some studies that show that, if you get this vaccination or the booster in the same arm that you got it previously, it may increase your immunity. But, those studies are limited until we have more definitive evidence with more studies that evaluate a larger patient sample. It's hard to be that definitive. So I would say just the important thing is to get the booster.
Okay, got it. Looking at that video, I have to tell you, I always wonder how does that needle not hit your bone? And I'm so glad it doesn't. And I know you guys are professionals, but watching that, I'm thinking, oh my gosh, it's coming again. Okay, so I got to get my booster this year. Now, another question that a lot of us have. There's this highly mutated variant going around. Is that true? And if so, should we be worried?
It's true. Yeah, there's a new BA.286 variant. That's what it's called. And, there's a lot that we don't know, but we do know some things, right? We know that this has been reported in many different countries throughout the world. We know that, a handful of people have had this. We know that those who have had it, the symptoms have been mild. So that's a good thing for us, right? Just they presented with, fever, headache, sore throat, runny nose, the typical COVID symptoms, and it hasn't been spreading widely yet. Now, that could obviously change in a day, a week. There's so much that we don't know. We don't know how transmissible this new variant is. We don't know if it can result in serious illness. So we have to be really vigilant and very careful and monitor this, with time.
hmm Are we seeing the general trend be what we expected it to be at the beginning, which is that things become more transmissible but less dangerous as time goes on?
It's hard to say because everything and all the different variants act very differently. This new highly mutant variant is different genetically than any other variant that we've seen. So it becomes very hard to predict its character, how serious is it's going to be, what potential it's going to have to result in serious illness. So we really have to watch it, get more data on it and see with time what happens.
Wait and see. How about the booster shot? Because my understanding was it's kind of like the flu shot. They have to anticipate what you're going to be dealing with and engineer it for that. Is that ready for this BA, what was it, 26?
Yeah, BA.286. Yeah, it remains to be seen, Chance. Honestly, it remains to be seen whether it's actually going to be effective against this new variant because the pharmaceutical manufacturers who have, you know, created this new booster, which will be available in mid-September. It's mainly to target the dominant strains, which are EG5 and FL151, right? So it's going to be very effective against those strains, but whether or not it's going to be effective against this new highly mutant variant remains to be seen.
hmm So, Dr. Owan, some companies, some colleges are reinstating mask and safety mandates. And there's pushback, people saying, wear a mask if you want to wear a mask. Let your student wear a mask if they want to wear a mask. Do not try to do another blanket mandate on us. Is that reasonable to say enough with the blankets, let each person decide?
Well, we know, Chance, that masks prevent the spread of infection, they prevent the transmission of the virus. So we shouldn't hesitate to wear masks. Now,
Sure.
obviously, it depends on your personal circumstance and those that are around you. So if you're 65 years of age and older, if you're around immunocompromised patients, which means those that have an underlying condition like lung disease, diabetes, organ transplant recipients, those on chemotherapy, steroids, you want to be vigilant and wear a mask, not only to protect yourself, but to protect those around you that may not be able to protect themselves. So I would say we should be very open to wearing masks and it's going to prevent the spread and the transmission of the virus.
Sure, but don't wiggle out of this, doctor. I'm talking about a mandate. Are mandates appropriate and necessary, or should it be personal?
I don't think mandates are necessary, and this is my opinion. I don't think mandates are necessary currently. We are seeing a rise in infections, but it's nothing like the peaks that we saw, in previous years and previous summers and previous winters. So, it is a concern right now, but I think we all need to be vigilant. We all need to do our part by, getting vaccinated, staying home if we're sick, washing our hands. If we're in an area where we're around immunocompromised people, absolutely we should wear a mask. But a mandate is different, and I don't know that we're quite ready for a mandate right now.
Understood. Overall, hospitalization and deaths, they're not skyrocketing. We can say that. What is your general level of concern if you're on a 1 to 10 scale right now?
I'm concerned, Chance. I'm not alarmed, but I'm concerned. So I would say my scale would probably be a 5 or 6. We're certainly seeing a
Okay.
rise in infections, a rise in hospitalizations, but again, nothing like what we saw in the peaks last year or the year before. So definitely something to keep an
Mhm.
eye on, but I'm not alarmed by what's happening right now.
5 or 6, that ain't nothing. Dr. Omer Awan, I always love having you on because I can nudge a little bit to get some good insight because a lot of us are thinking, how concerned should I be? So I appreciate it.
Thanks for having me, Chance.